Hey, my name is Evelyn, and I will be talking to you about a class of drugs called bisphosphonates. So our bones undergo a remodeling process. Under normal circumstances, our bones begin to break down. This is known as bone resorption. Afterwards, new bone tissue begins to form. There are several factors that affect bone loss, such as aging, smoking, vitamin D deficiency, menopause, calcium and magnesium deficiency, medications, alcohol, and also reduce physical activity. There are conditions that can alter or impede the normal physiologic process of bone resorption and remodeling, such as Paget's disease and malignancy. Having said this, there are medications that can contribute to bone health, such as bisphosphonates. You might ask yourself, what effects do these drugs have in my body? Bisphosphonates adhere to bone and inhibit osteoclastic activity. They are also potent inhibitors of both normal and abnormal bone resorption. Drugs in this class typically end in DRONATE. An example of this drug is alendronate, also known as Fosamax. The next question you might ask yourself is, what happens to these drugs once they go into our system? Bisphosphonates are readily absorbed on an empty stomach. To ensure adequate absorption, this class of drugs should be taken with an 8-ounce glass of water. Drugs in this class are widely distributed to the bone. The half-life is usually long, and it ranges anything from 150 hours to 10 years. Bisphosphonates are considered pregnancy category C, but pamidronate and zoledronic acid are pregnancy category D. These drugs are excreted in urine and do not undergo a systemic metabolism. The most common side effects of bisphosphonates are esophagitis, gastric irritation, and indigestion. This class of drugs should not be taken if you have severe renal impairment, Barrett's esophagus, or low calcium levels. If you have GI or stomach disorders, you should take with caution as well. Also, be careful if you are pregnant or breastfeeding and you choose to take a drug from this class. The benefits versus the risks should be fully considered. Bisphosphonates may interact with other drugs you might be taking, such as nonsteroidal anti-inflammatory drugs like ibuprofen, aspirin, calcium supplements, and antacids. When taking a bisphosphonate with aspirin or a nonsteroidal anti-inflammatory drug, the risk of bleeding increases. Absorption of bisphosphonate may decrease when taken with calcium supplements or TUMS. If you have thin or fragile bones or abnormal bone densities, your doctor may prescribe you a bisphosphonate. So how should you take a medication in this class of drugs? Bisphosphonates must be taken first thing in the morning, at least 30 minutes prior to taking any other medications, foods, or drinks. It should also be taken with 8 ounces of water, and after taking the medication, you need to sit up for at least 30 minutes to avoid or reduce the risk of any GI distress or irritation to your esophagus. If you miss a dose, just skip it for the day and resume on the following day. As always, make sure to follow up closely with your primary care provider to monitor your progress and response to treatment. Thank you for watching my video.